and health students, and welcome to a brand new week. Well done in completing the outcome task. I know there's a couple of people that still have it overdue, and I'll just send you an email to remind you because I really want that finished and we move on. What I've made a decision to do is to complete all of the content that you're going to need to know for this new outcome and this new topic, subtopic, within health and wellness and well-being, all today. So there's going to be a fair bit of listening and notes. There's no worksheet. There's nothing that you need to submit to me. Just confirm your email attendance with me. Zoom can be set up if you need any assistance. Just listen, pause, take some notes down, because there's going to be work that's going to be delivered on Thursday's class that is all based around this learning. That work from Thursday's class relates directly to the outcome tasks that you'll be completing at the start of next week. So, content today, work around this same content on Thursday's class, and next week on Monday, our next outcome task. A little bit shorter, a one lesson outcome task compared to the last one, but it's all based around this topic here, which is the socio-cultural influences. We touched on that in the last lesson of last time prior to the outcome task. A reminder, there's no official health class on Wednesday because you have your student-led conferences. So let's get into it. Sociocultural health factors. Now, this was right at the end of the PowerPoint from last time, but we're going to get into it in detail. Now, what are the factors that contribute to changes or variations in health status? And when we take those factors, we want to look at the socio-cultural. Just very quickly, socio, it's like social. It's a group of people, family, friends, acquaintances. And cultural, it's the culture in which people are growing up within. So if we look at the socio-cultural factors here, we can see that the SES, socioeconomic status, unemployment factors, connections with other people, and exclusion, isolation, different influences from cultures, security behind food, early life experiences, and access to healthcare all play a big part here. So when we say socio-cultural factors, we're talking about the conditions under which people are born into, grow, live, work, and age into. So as I mentioned on the previous slide, all of those things have been listed. Feel free to pause and take them down in your notes because each of those categories are important, and we'll take some sub-notes on those throughout today's lesson. So just summarizing for you, people who experience poor socio-cultural conditions will generally experience worse health status in all societies. So what we need to understand is that while we can categorize different countries or different states or different suburbs or different parts of the world into specific and overall categories, we need to understand that within any category, the experiences that people suffer within their socio-cultural circles will indicate what their health status will be. And a reminder that the health status is a continuum. And so that continuum is from excellent health to poor health or loss of life. What we're trying to do here is understand that there is a connection and that we're trying to actually be able to help try and minimize the gap in that connection. So SES, socioeconomic status. This refers to somebody's income, occupation, and education. Let me break the three of these down. Somebody who has a high level of income will mean that they have access to resources. That means they're able to buy a house, buy good healthy food, pay for healthcare, whether it be private health insurance, etc. They're able to pay for gym memberships, recreation. All of these things mean that people who have a high income have access to all of the things that make them able to live a healthy lifestyle. This can help increase their years of life. Occupation. Occupation means that when I am involved in a particular job, some jobs have a lot of injury risks. Some jobs that include manual labor mean that there's muscles, tendons, ligaments that quite often will be damaged because they're being used more often than others. And there's some other occupations and jobs which involve sitting at a desk for a very long period of time, like administrative roles. and they cover their own level of risk. And so, if we couple that with income, if somebody is at a job where they're at high risk of hurting themselves and maybe not making a lot of money to be able to pay for healthcare, those two factors can couple together to prove quite negative. The third and final one is education, and there's a link between the higher the education that someone has. That means the higher level of schooling they manage to get to, hopefully without dropping out, and also if they left school and went on to tertiary studies such as university, TAFE, or colleges. The higher the level of education generally means the higher the paying job, which can then get back to income and occupations. Now we need to look at the other end of things. So if somebody is completing school, they've gone all the way through to the end, they've gone to university, they're more likely to get a high paying job. They're more likely to have a really good run of things in terms of their health. However, when we look at somebody who is in the unemployment area, there is a huge link between unemployment and a lower health status. So, unemployment has a high chance of dying and suffering from more illnesses than people at the exact same age who are employed. The effects of the long-term unemployment can be very serious on the financial factors and the psychological factors. Can be very difficult providing food for families. Can be very difficult paying to keep houses running. It can be extremely difficult if somebody starts to fall into debt and starts to owe money, and if they're unemployed and not making money to pay it back, this can cause huge issues. And if we think about our health status as not just physical health, mental, emotional, etc., we can see how this has a negative effect. So, social connections. This is the bonds between people. It's their relationships with friends, families, acquaintances, work partners, etc. When people are being socially connected, we know that there's a lower risk of morbidity and there is an increased life expectancy. Social exclusion refers to segregation, or when people are not being socially connected. And sometimes social exclusion can come because somebody has no employment, has a lower level of education, maybe because of where they're living, maybe because of their social security services that they can't gain access to things. So social exclusion can also lead to disability, breakdown in family, discrimination, low income, poor physical and mental emotional health and well-being. When we think of social exclusion, quite often we need to think of homelessness. What I would like you to do is pause this video, open up a new web browser. Once you've gone to Compass and Resources and found this PowerPoint, click on this TED Talk. It's absolutely mind-blowing listening to homelessness come from people who have experienced it or are close to experiencing it. I know that in the Year 9 Melbourne City experience, there was a tour of some of the back streets and asking you, how do you feel right now going through some of these back streets, and talking to people who have been through homelessness. And I know that there's more of an awareness of homelessness, but we also need to understand it. So pause this video, go and have a listen to that TED Talk, and then come back. Now that you've come back, think about, has this changed your view of homelessness, and how? So what is your definition of homelessness? And then there's something there that asks you to explain how individuals can give hope to somebody who is experiencing homelessness. And I would ask you to think about yourself in your current situation as a Year 10 student. Is there anything you could do to help someone in homelessness? Social isolation is an interesting one because obviously right now, a lot of us are experiencing social isolation. So I ask you when we're going through this slide, to start auditing yourself. And I know I've asked you to audit yourself a few times, but health is such a grand subject where you can audit yourself at times. Social isolation refers to not being in contact with others. Sometimes there's geographical barriers that prevent people from being able to go to different areas. Right now, we have geographical barriers. There are laws in place that you cannot leave 5 kilometers from your home. Has that affected your health status? Mental, physical, social, emotional, spiritual. I know for myself that my physical well-being, I'm going for runs that are much shorter, just around my house and my area, whereas I used to enjoy going for a 10 or 15 kilometer run that's not very repetitive and cyclical around my area. Social isolation can be caused because of disability, illness, or a lack of transport. So it's difficult for people to get from place to place, but also if you're living in another country and you're finding it difficult to communicate with English or non English speaking backgrounds. So, cultural influences, not the social isolation, the cultural influences, relate to the different customs, values, and traditions of societies. What we need to understand here is that a big part of this comes down to gender stereotypes, food intake, attitudes, and beliefs. Gender stereotypes refers to the behaviors that are usually acceptable because of cultures and how they've made them for both males and females. I know that this has been learnt and discussed through year 7, year 8, year 9, and it's not something that we want to spend a lot of time focusing on right now, but I want you to think about how being a male or being a female in the society in which we live, do you think that could lead to different health status influences? Do you think that being a male, because of cultural influences, would improve or decline health status? Do you think that being a female in the current culture in which you live and grow up amongst can affect positive or negative your health status? Food security, the state in which somebody is able to obtain nutritionally adequate and culturally appropriate safe food. A shortage of products can lead to a deficiency in disease. We see that when we fear the lockdown, people rush out to go and buy food because they're worried about that affecting their health. This can contribute, though, to maybe people eating too much and putting themselves at risk of other dietary related diseases like type 2 diabetes or cardiovascular disease. So, what we need to understand here is that every person plays a part, a product of their past experiences here. Apologies. Every person plays a part in making sure that food security is for all. Think about in your local area what you can do to ensure that there is food security for all as of right now, but also think about how you might be able to help those in other countries in other worse off situations. Now I go back to this third doc point. Every person is a product of their past experiences. So by watching your parents and how they influence and manage their lives and their behaviors can help with your experiences moving on. If your parents were very active, the likelihood is you will be very active. If your parents or guardians like to eat a lot of junk food and not healthy foods, that would lead you to eating those junk foods and healthy foods moving forward. Access to healthcare. Healthcare refers to services that promote and preserve health and well-being. We talk about things like doctors, nurses, scientists, dentists, pharmacists, physiotherapists, naturopaths, myotherapists, all of these healthcare workers. And if people are able to access them, either by the geographical access or because they are able to afford them due to their income, their SES, which we discussed earlier, that has an influence on the status of health. The final thing I'd like you to have a little quick look at here, going back to the PowerPoint and accessing this TED Talk, is an overall summary talking about geographical locations, so where you are born. This is going to play a big role in the task that you complete on Thursday. Thursday's task is all about where you live, somewhere that you think would be in one end of the spectrum, and something that you think would be on the other end of the continuum. So start thinking about that. There are different environmental factors, such as the housing, the quality of the housing, the environment of the work and the safety of that environment, the design and infrastructure around the environment, whether there's parks, pathways, it's safe, etc. And also the climate and the changing climate. Is it too hot? Is it too rainy? Is it too cold? Thank you guys for switching in and staying for this for as long as you have. Well done. Make sure that you've taken those notes down. Pause to watch those two TED Talks. And don't forget that you have to have emailed me to confirm your attendance for today's class, because there's no submission of work for today's class. As I said, student-led conferences on Wednesday, no health class, and then you will come back to class on Thursday, where you will use the information that was delivered today to complete a socio-cultural activity. I hope you've enjoyed this, and thank you.